If you have any comments or questions, please put them in the comments here below. But let's get started on reviewing or kind of going through the different blood tests that you want to keep track of while for your own personal health folder or health file. Um, the blood tests that we're going to talk about today aren't always ordered for every physical when you're feeling okay. However, this is meant for just kind of looking again, doing a little bit of a deeper holistic dive into your health and what to look for when you're at your physician's office or your yearly physical. So to get started, we'll start with, it's called a CBC, the complete blood count. And this is a typical blood test that's done at your doctor's office. And this tests for your white blood cells, your red blood cells. It will have your hemoglobin in it. It will have if it's with differentials, which is a piece of the CBC, the complete blood count, that will give us even more information. So to kind of look at what you want to do with any of your blood tests is, like I said, you want to keep a folder with all of your historical, your past blood results. And then I want you to keep track. Hopefully you're going to your physician every year to get a physical, but I want you to keep track of the different levels, because the range of normal is often not optimal. And so you can, for instance, we'll go back to the CBC in a minute, but for instance, vitamin D is a common one that is being tested. And here in the States, normal is anywhere from 25, usually 25 to 100. And we usually like to see your vitamin D at around 40. And so, with your vitamin D levels, with that large of a range of being normal, you could be at 25 at one point and then 70 at one point, and you're all within normal ranges. But it's the pattern and seeing what the trend is to see what is normal for you. So really making sure, usually the primary care or the general practitioner will make sure that the levels are within normal range and say everything is great. Now, what we can see, especially for things like blood sugar or thyroid levels, which we'll get into in a minute, if you're jumping all around within that normal range, that can be a quick trigger to say, let me dive deeper, a little bit deeper into what's going on. So if you as the patient, you as being your own health advocate, which we all want you to, that's what we want you all to be doing, is being your own health advocate. If you keep your records in, again, a folder on your computer or a hard copy, and you can keep track each year what your blood results are doing, that again can give you an idea of, just because they're in the normal range, if they're trending higher or lower, then we can get it before we can address the issue before it gets out of that normal range. So let's get started. Like I said, CBC. So you want to make sure they're all within the middle of the normal range. So the reference range will usually be when you're given the results, the reference ranges are usually in a parenthesis right next to the normal range. You want to make sure that all of your ranges are right in the middle of that reference range. A couple things that you want to look at, especially for your energy levels, is your hemoglobin. Hemoglobin is a measure of how much oxygen can be transported within your blood. And if that hemoglobin is low or low end of normal, it's reasoning to look for, and you're experiencing tiredness, it's a reason to look a little deeper, and you want to look for your iron levels. So sometimes, now if your hemoglobin is below the normal range, you definitely want to look for iron levels. So you want to ask your doctor for your iron levels to be tested, and not only iron, but your ferritin. So iron, just to kind of back up a little bit for physiology, iron is a big component of heme or hemoglobin, your hemoglobin count. And so when your iron is low in your blood work, your hemoglobin is going to be low as well on your CBC. CBC stands for, again, complete blood count, and that's usually drawn at most physicals. So if your hemoglobin is low, your iron is most likely low as well. And so some reasons why it may be low is if you're having a really heavy period or you're bleeding a lot. Or if you just had surgery, that is a really a common reason why your hemoglobin or your iron would be low. Now, another reason that we look at in naturopathic medicine is if you, again, going back to your digestive system, if your digestive system is out of balance, then you have an overgrowth of yeast or candida, the bad kind of fungal infection that if it grows too much, that eats iron. And again, iron is really important for energy because it's what helps your body to deliver oxygen throughout your different organs. So making sure that your hemoglobin is in a good place in your CBC, that can really be indicative of your iron levels. So that's where we want to start. Now, again, if you're asking for, if you have a really good relationship with your family physician, your primary care doctor, your general practitioner, which we both, Tanya and myself, really encourage you to have that really good relationship and have your kind of healthcare dream team, then you can have a dialogue to really help to monitor these other blood tests that aren't always ordered in the routine physical. Iron and ferritin being one of them. So your most physicals are going to start off with usually a lipid panel, which is your cholesterol, and a CBC, again, which is complete blood count, and a CMP, which is a comprehensive metabolic panel. Those are usually what's drawn in a physical exam, a yearly physical. So CBC, we kind of went over, that tests your white blood cells, which is your immune health, and it will be usually abbreviated to WBC. So white blood cells, your red blood cells, that's going to be saying RBC. Your hemoglobin, again, kind of an indirect measure of your iron. And then if it has diff, that means basophils, eosinophils, monocytes. Those are an indicator of, those are all white blood cells or part of your immune system. And those tell us if your body's immune system is kind of overreacting or if it's more because of an allergy, or it also gives us insight on how your digestive system is working. So that you can get a lot of information from your CBC. But again, the main ones for energy is you want to make sure that all of the levels are right in the middle of the reference ranges, especially that hemoglobin. Now, moving on to a CMP, a comprehensive metabolic panel that many of us will see. You'll see that tests your liver function and your kidney function. So what you're looking for is they are enzymes called AST or ALT. Those are measurements of your liver health, and your liver health is incredibly important for overall detox and for helping to support good circulatory system, your blood flow throughout your body. Kidneys are really important as well, and you can test your levels of in your kidneys by looking for the BUN or GFR. Those are going to be in the comprehensive metabolic panel or CMP. A lot of initials here. Oh my goodness. But that's a way to test your liver and kidney health. And then the other thing that's really important that you're looking for in the comprehensive metabolic panel is your glucose. And this is usually the family practitioners are asking the patients or you guys to fast overnight before you get your blood drawn. And the glucose is your fasting blood sugar. Now, fasting blood sugar should be lower usually than a blood sugar levels when you're eating. But what you want your blood sugars levels, again, to be right in that middle range of the fasting blood glucose. And so that tells us how your body responds to sugar in its blood. It should be lower. And that's one of those that you want to make sure that you're paying attention to each year because it has the tendency to kind of creep higher and higher. And when it's going higher than we would like in the States is around 99 is the cutoff. That if it's going higher than that or trending higher in the higher directions, that's indicating that we need more protein. Protein, again, really helps to stabilize blood sugar and eating less of the carbohydrates. And so eating less of the processed foods and more of the foods that come from the ground or more fiber rich foods and healthy fats. Those will all decrease your blood glucose level, and that will help to stabilize your blood sugar and in turn give you more energy. So now we've gone over the CBC, so the complete blood count, again, the hemoglobin you want to look at. We want to look at for the CMP, the comprehensive metabolic panel, you want to look at that fasting glucose level and make sure it's within that middle of that reference range. And if it's creeping up too high, then you want to, or actually too low, that could indicate hypoglycemia. Or low blood sugar, then you want to add more protein, more fiber, like we've talked about the psyllium husk to add in fiber or flax seeds, or more vegetables, and more good fats. So the avocados, the nuts, the wild caught salmon, those good fats help to mute down the increase in blood sugar that you get with simple carbohydrates or processed foods. So moving on to different blood levels that you might want to ask for your family physician or your primary care doctor. If all of those are normal and you're still exhausted and you're still tired and you're moving through this program and you have an appointment with your primary care physician, these are some optional tests that we do in our office with our one-on-one clients, but they can be really helpful. So one of the things that we will often do is we'll test B12 levels. Now, we've talked a little bit about this in the past, but B12 levels are really important, especially for energy. Now, you need good stomach acid or acid in your stomach to actually absorb your B12. And B12 plays a big role in energy. So if your B12 is low, and then you really want to, again, go back and visit that digestion module in your Energized Mama method to really optimize your digestion by chewing your food and really focusing on probiotics and figuring out what your food sensitivities are. But that can all influence how you're going to absorb a B12. Now, B12 in the States has a really wide range of normal. So in most labs, normal for B12 is about 200 to 300. That's the lower end, depending on what lab you're going to, all the way up until about 1,000. Now that's again a huge range. And so you can have some, a level of B12 and it's, 301, let's say, and it's still within the normal range. However, what happens clinically is when we give people with a level of 300 B12, either a B12 shot or B12 supplement, or really focusing on helping to support their digestive system, or really increasing their clean animal protein. So the free range organic grass fed beef or free range organic chicken, that all can increase your B12 levels. So if you're following a plant-based diet or a vegan diet, it's a good idea to get your B12 and your iron checked regularly with your primary care doctor. Now, going back to B12, what happens is, again, if someone has a very low but normal B12 level, like I said, in the United States, let's say it's around 300. It's all within the normal range, and your medical doctor says it's normal, there's no need to make any changes. What happens is if we give someone that supplement, the B12 supplement, or have them eating more meat, their energy skyrockets. And so it's really fascinating that even though they're within the normal range of the blood levels, it can make a big difference with how they're feeling as long as we can get it in that upper range of normal for B12. So to kind of recap, we've got CBC, look at your hemoglobin, CMP, look at your glucose, the B12 levels, you want to be on the high end of normal, and the iron levels, iron and ferritin levels, you want to be in the upper 3/4 or in the middle range of your iron levels for your energy. Now, we want to go into thyroid. Thyroid can influence your energy quite a bit. And so if your thyroid is over functioning or under functioning, that can make a big difference with your overall energy levels. So thyroid, there are quite a few different blood tests for thyroid. The main one that's usually used is it's called the TSH, or the thyroid stimulating hormone. Now, with the TSH level, that's important. That's definitely important. However, that's not the whole picture with your thyroid. So a couple other things that you want to get tested if you can have a good relationship with your physician and explore a little bit more, is you want to have TSH, T3, T4, and thyroid antibodies tested, and reverse T3 if your lab offers it. So let me go through a little bit of physiology of why you want the full panel of thyroid rather than just your TSH. So for thyroid, what happens is your pituitary gland that's in your brain starts producing TSH, thyroid stimulating hormone. And that tells your thyroid, which is in your throat, to start producing T4 and T3. Now, T4 and T3 is the active form of the thyroid compound. So that's actually what is showing what and T4 is converted into T3. So by just testing the TSH, it's just telling us this one piece of the puzzle. It's showing how much the pituitary gland is telling your thyroid to produce, but it doesn't tell us how much of the actual thyroid hormone is circulating throughout your body. So that can be very confusing, and it can tell us that, your labs are normal, but we're not even looking at the full picture. So we don't know, we just know that your pituitary gland is telling your thyroid gland properly if your TSH is normal. However, it's not telling, is the thyroid actually producing the thyroid hormone? And then is your body converting the T4 to the T3? And so are all the steps in place in order to optimize your energy? Now, the other part of the thyroid that we want to test is your thyroid antibodies. Your thyroid antibodies tells us if your immune system is attacking your thyroid, making it not functioning optimally. If it is, then we need to support your digestive system again because your most of your immune system is in your digestive tract. So, if you have high thyroid antibodies, you will be diagnosed with what's called either Hashimoto's or Graves' disease. And that is your immune system attacking your thyroid. Now, in traditional medical world, it's treated the exact same way, whether you have the autoimmune thyroid issue or if you have a thyroid issue just because the thyroid isn't functioning as well as it should. In naturopathic medicine, those are treated quite differently. So it's good to get the full picture in terms of your thyroid TSH, T3, T4, thyroid antibodies. So we've gone through quite a few things for your lab work, for energy. It's B12, iron, CBC, CMP, and now your thyroid studies. Now, a couple other things that we want to make sure that we're looking for that's pretty hard to get done, and a lot of people will have to pay out of pocket if you want this lab test done. But there are two lab tests that test for inflammation. Now, inflammation levels can really make you tired because what happens is if your body is inflamed, then your body is trying to kind of put out these fires as opposed to giving you more energy. So, monitoring your inflammation levels each year can be really helpful to make sure that you are keeping overall inflammation down. Now, inflammation can come from so many different places. So, that's kind of a tricky situation that you might want to make an individual appointment with either Tanya or myself to discuss. But that being said, or another naturopathic doctor. However, the Energized Mama method is focusing on decreasing inflammation overall to help to increase your energy. So if you're going through the program, then we're definitely addressing inflammation. The two tests that we use to test for inflammation levels is called the C-reactive protein or CRP and ESR or erythrocyte sedimentation rate. Now, ESR and CRP are both levels, like I said, to test you for your inflammation. Now, if those are a little bit high, it could indicate, it's indicating that your inflammation is a little bit high, but it can be from if you have an infection, if you're fighting off a cold, or if you've worked out too hard, or it can also be indicated if you have like an injury. So if you fall and, break your ankle, your CRP is supposed to be high because that's your body's way of telling you to help to heal. Now, but if you're feeling okay, you don't have any injuries and you're not coming down with any sicknesses and your CRP or ESR is elevated, we have to do a little bit more digging to see where the inflammation is coming from. Is it coming from your digestive tract, which a lot of times it is? Is it coming from hormones? Is it coming from a dysregulation of sugar or blood sugar or your thyroid levels? So we look and see we dive a little bit deeper. And you are doing all of this within the modules of the Energized Mama method by seeing, making sure that you're optimizing your digestion and optimizing your hormones and decreasing stress. And really finding if there's any kind of food sensitivities with gluten and dairy. So those are big ones to help to decrease inflammation. So that's kind of an overview of what you're looking for blood tests from your family physician. The last one that we haven't covered is your lipid profile. Your lipid profile tests your cholesterol levels. Now, your HDL is your good cholesterol. You want that high, and you want your LDL LDL cholesterol low. Those in your triglycerides, you want low as well. Your triglycerides are really important to keep an eye on. And if your triglycerides are creeping up each year, that's another indicator that you need to decrease carbohydrates, decrease processed foods, decrease sugar, and increase the fruits and vegetables and the protein. So keep an eye on your triglycerides. And then there's a ratio of the HDL and LDL. And you want that ratio to be low because that overall, when the lower it is and the higher your HDL or your good cholesterol is, the more energy you're going to have. The lower the triglycerides are, the more energy you're going to have. So I want to recap just to kind of review of what you're looking for. You're going to get your CBC, that's complete blood count. Look at your hemoglobin. CMP, comprehensive metabolic panel, make sure your BUN and AST and ALT are all normal, are within the normal range, but keep an eye on that glucose level, that fasting glucose level, that it stays consistent. Now, the iron levels, you want to be in the middle or top end in the ferritin, that's your iron storage. B12, you definitely want to be in the higher 3/4 of the normal range. You want to make sure that your B12 is optimal. You want to have a low CRP and ESR. Those are your inflammatory markers. We discussed vitamin D a little bit in the beginning, but again, vitamin D should be around 40, right in the middle of the normal range. That's your sunshine vitamin. And then make sure that you're looking at TSH, T3, T4, and thyroid antibodies for your thyroid health. So those are kind of an overview of overall blood tests that you can ask for and look at. And again, keep a file of them, whether it's electronically or an actual hard file, because so you can keep track of what your trends are. A lot of these MyChart or electronic medical records that different doctors' offices have or different hospitals have a feature where you can trend your results in a graph setting. So that's really helpful too, to kind of see any kind of patterns. So please put any questions or comments below, and we will definitely get to them, and make sure that you keep the questions coming. We love them, whether it's in our email box or in the Facebook group. We love chatting with you guys, and we will see you next week. And hopefully Tanya and all of you are getting time for rest and relaxation. It was great to talk with all of you. Bye-bye for now.